Now, some hospital employees on New York's Staten Island are protesting former Governor Andrew Cuomo's vaccine mandate for all healthcare workers. The protests come as Staten Island sees the highest infection rate of any New York City borough. Yasmin Basugian is outside Staten Island University Hospital. Yasmin, good morning. So first, let's just start with the current vaccination numbers there. So what percentage of the population is vaccinated, and what does that rate look like specifically among hospital staff?
All right, so you're talking about all of Staten Island in general, right? You got 53% of folks on Staten Island fully vaccinated, 59% with only one dose. If you're talking about the hospital behind me, for instance, they're kind of part of this big healthcare conglomerate called Northwell Health. 80% of employees at Northwell Health are currently vaccinated. We're actually trying to work on getting the specific number when it comes to the hospital behind me. But let's talk timelines for a moment, right? August 16th, the hospital behind me essentially said, listen, you got to get vaccinated. If you're not getting vaccinated, then you're going to be subject to weekly testing. And then former Governor Cuomo now instituted the fact that healthcare workers across the state have to be vaccinated by September 27th or face possible termination. That is somewhat vague, but I was actually talking to the folks here at the hospital that said, listen, if the state is saying that we have to terminate these folks if they are not fully vaccinated by September 27th, we are prepared to do so. And as you mentioned, there have been a lot of protests outside this hospital beginning on August 16th when they put this policy in place. Many healthcare workers, nurses, technicians, and so on and so forth saying, listen, we're not going to get vaccinated. And they continue to protest. We're going to be talking to some of those folks throughout the day here, Savannah.
Yeah, I know you spoke to one of them already, a nurse who chose to leave her job rather than get the vaccine. What did she tell you about making that decision?
I did. And it's interesting, right, because you had the FDA approval come yesterday for the Pfizer vaccine, full FDA approval at that point. And in my reporting over the last couple of months, really, since the vaccine kind of hit the market, a lot of folks have been telling me, listen, once this thing gets fully approved, there is a possibility that I'll consider getting this vaccine. So I think a lot of us thought we would come out here and there would be a lot of folks saying, listen, OK, now's the time I can get it because it has been fully approved. We're not necessarily hearing that as of yet. And of course, we're going to be talking to more and more folks throughout the day. This nurse, for instance, she's been a nurse here for 15 years. She actually said that she thought she was going to be able to retire here. She wanted to spend the rest of her career kind of giving her services here at this hospital. She is having some fertility issues, trying to get pregnant. She is worried about what this vaccine is going to do for that process. Now, I want to be clear about the science before I play her sound, that there's no science that suggests, and Dr. Patel can back me up on this, that these vaccines cause any fertility issues, even so far as to say that the CDC is encouraging and telling pregnant women to go ahead and get vaccinated. It is completely safe to get vaccinated. 200 million people in this country so far have, in fact, been vaccinated. That being said, let's take a listen to this nurse.
I am not like anti-vax. Like I've gotten vaccinated in the past. My child has gotten vaccinated up to this point. This one specifically, I just feel like there are no long-term studies. I'm not opposed to it in the future. And I've told my doctors I'm not opposed to it after possible pregnancy and giving birth. I'm not opposed to it. We're supposed to protect our children. So God forbid I got pregnant and I took the vaccine and something happens to this child, I will never be able to live with myself. Like I will blame myself for the rest of my life. And I can't do that.
And I just want to reiterate, there is nothing that suggests that these vaccines put any type of pregnancy or fertility in danger. Again, many pregnant women across this country have been vaccinated, have gone on to have healthy children, are currently healthy themselves. But nonetheless, that is some of what we are hearing, especially from a woman like that who's been a nurse here for 15 years and facing fertility issues. That is a choice that she is making. And she says she's ready to be terminated if, in fact, that's her fate.
Yasmin, you said it. There's not the science to back that up, but that is a concern. I've been hearing it as well in reporting. So thank you for that sound. And as you said, we'll have Dr. Kavita Patel be able to kind of walk us through that. Yasmin, thanks so much.